Hey Central Virginia, Dr. Lynch here. And if you or someone you know is suffering with sciatic pain, leg pain, lower back pain, or disc pain, then this video will be for you. Because in this short video, I'm going to go through how we help patients with sciatic pain. This picture right here is showing your sacrum or your tailbone. This would be the right hip and the right leg bone. These are the bones in your lower back. And this yellow right here is your sciatic nerve, which incidentally is made up of several levels of the lumbar spine from L3 down to about S2. And those nerves come together and make up the sciatic nerve, which comes down through this piriformis muscle shown here in red. So many times when people are having problems there, it's from pressure of that piriformis muscle pressing on that sciatic nerve. Now it can also be due to somebody sitting on a wallet. So if you're a person who sits on your wallet while you work, take it out, put it in your front pocket or somewhere else so that it's not pressing on this nerve root. But what we frequently see is spinal misalignment at those vertebral levels above it. So at L3, L4, and L5, if those vertebrae become out of position, what can happen is it can press that disc up into that nerve root, causing that nerve to be irritated. When the nerve becomes irritated, it's going to traction that piriformis muscle and it's going to tighten across that sciatic nerve. And that's typically when you're going to either feel pain in the back or down into the hip and leg. But frequently patients will be able to point with one finger and point right at that back pocket, and they say it hurts right here, and that's where it's coming from. Now, you can take medication and it will block that pain. You can take injections or get radio frequency. Once again, it'll block that pain. You can do exercises to strengthen around the area so that you can handle this better. But you're still going to have this problem developing. And what we see with most spinal conditions is over time they just have a tendency to get worse and the condition progresses. So what we recommend is our approach to heal this area so that it's not something that continues to come back. Now our approach is done with instrument adjusting. I never do any twisting, popping, or cracking. It's not necessary. What we do is use an instrument to make our corrections. And incidentally, you can't even do that from the back of the spine. You have to come around from an oblique angle to set that disc. Now when I tell patients that, they say, what in the world do you do if you don't twist, pop, and crack people? I say, watch the video that's posted above this video post because it will go into much more detail in explaining how we make those corrections. It will also go into detail in how we use cold laser to help heal those nerves. Using a cold laser over a nerve root is like applying a battery charger to a weakened battery. It speeds it up. It's going to help it heal faster. We also use percussion therapy and rapid release therapy to release scar tissue adhesions, which can develop down around that sciatic nerve, causing more irritation, more pain going down into the leg. We also address lower crossed syndromes. Now, in a lower cross syndrome, your pelvis will be off. So if we were looking at me from the side and you're looking at the front of my belt and the back of my belt, they should be level. But you've seen the people, it looks like their belly sticks out, their belt comes down low, and then their back kind of rounds or hollows. That puts more pressure on one set of muscles pulling the pelvis down on one side, and the overside's over tightened. And it causes these problems to come back and come back and come back. In our office, we address all of those things so that we're really putting the pelvis on a good foundation, helping the nerves and discs in the spine heal and the muscles to relax so you don't have the pain, you get better mobility, you're going to work better and feel better, because that's our approach. Watch the long video if you're interested. In making an appointment, I would encourage you to watch it first. Give our office a call at 434-245-8456. We're located behind Toys R Us off 29 in Charlottesville. I'm Dr. Keith Lynch. I've been in private practice here in Charlottesville since 1998. I enjoy helping patients get better from these type of things so you can get back to all the active things that they want to do in their life.